You might have heard it called Dr. Strangelove syndrome, and it's easily one of the most bizarre conditions in all of neurology, alien hand syndrome. We're talking about a rare disorder where a person's limb, usually one of their hands, just starts moving and acting with a mind of its own. It's completely outside of their control. So let's get into what is really going on when a part of you is, well, no longer you.
I mean, just really think about that for a second. Your own hand, the one you've relied on your entire life, suddenly starts unbuttoning your shirt while you're actively trying to button it up. Or maybe it just starts grabbing random objects you don't want. It's this profound, scary breakdown of your own personal agency, and for a small number of people, this is their reality.
And this isn't some new, modern discovery. Nope. The condition was first medically described way back in 1908. A doctor named Kurt Goldstein was documenting a patient, and he nailed the feeling with this one phrase. He was describing a kind of apraxia, which is basically when your brain can't quite tell your body how to do a simple, purposeful action. And he defined it by that deep, unsettling sense of disconnect. Okay, so what on earth is happening inside the brain to cause something so specific and so strange? To really get the why, we've got to take a look at the brain's internal communication system. I want you to meet the corpus callosum. Think of it as this massive superhighway of nerve fibers running right down the middle of your brain, connecting the left and right hemispheres. This structure is absolutely critical. It's what lets your two halves talk to each other, coordinate movement, and make sure your hands work together like a team. But what happens when that superhighway suddenly collapses? Right here, you're looking at an MRI scan of a brain that's had a corpus callosum infarction. Basically, it's a stroke that hits that exact communication bridge. See that bright white spot? That's the damage. When this bridge is out, the two hemispheres can't talk to each other properly. Motor commands get lost, stop signs don't get through, and the result can be one hand going rogue, acting completely on its own. Now, here's where it gets really interesting. Alien hand syndrome, or AHS, isn't just one thing. It actually shows up in different ways, and it all depends on which part of the brain's network got hit. So let's break down the three main versions. The location of the damage totally changes how the alien hand acts. So if the frontal lobe gets hit, that's the brain's impulse control center, the hand becomes really impulsive, compulsively grabbing onto things. If it's the corpus callosum, that superhighway we were just talking about, you get what's called intermanual conflict, where the two hands will literally fight each other. And if the damage is in the back, in the posterior regions that handle sensory info, it's less about action and more about that deep, creepy feeling that the hand just isn't yours. So just how rare are we talking here? Well, a recent study gives us a fantastic sense of scale. Researchers went back and looked at every single patient admitted for a stroke in the corpus callosum over a 10-year period. Their question was simple. Out of all the people with the exact type of brain injury that can cause this, how many actually developed alien hand syndrome? That's right, only 5 out of 157 people. This really drives home that even within the specific group of patients with the exact brain injury known to cause it, the syndrome is incredibly rare, popping up in just over 3% of cases. And you can see why it's so often missed or misdiagnosed. Now, to make this a little more real, let's look at one of those 5 patients. He was a 47-year-old man who developed that classic intermanual conflict. His hands were working against each other. But here's the most important part of his story. His symptoms only lasted for 4 days. And by the time he left the hospital, he had completely recovered. This is so key because it shows that for some people, especially stroke survivors, AHS can be temporary. There's hope for recovery. You know, when a patient says my hand isn't my own, it's a pretty natural question to wonder, is this neurological or is it psychological? Is it all in their head? And for doctors, making that distinction is absolutely critical. The key difference really boils down to a physical cause. With AHS, you can literally point to a lesion, damage, on a brain scan. That's the smoking gun. And that's why the patient's feeling is described as ego dystonic. It means the hand's actions genuinely conflict with their conscious self. On the flip side, with psychogenic movement disorders, there isn't that clear physical signature in the brain, and the movements might be linked more to psychological factors. Okay, so we know it's rare and we know what causes it, but what can actually be done for these patients? Let's talk about the prognosis and the path to getting better. So while stroke is definitely the big one, the primary trigger for AHS, it's not the only player in the game. Things like neurodegenerative diseases, brain tumors, even brain surgery can cause it too. And what caused it is the single biggest factor in figuring out a patient's long-term outlook. Yeah, this is why the cause matters so much. If AHS is triggered by something progressive, like a neurodegenerative disease, the prognosis is often pretty poor. But, and this is a big but, when it's caused by a stroke, the outlook is often the best. The brain has this amazing ability to heal and rewire itself. It's called neuroplasticity, and that means many patients can actually achieve a partial or even a full recovery.
So there's no single cure, but there is a multi-step approach to managing and recovering from AHS. First step, you've got to treat the underlying cause, like using antiplatelet therapy for a stroke. Then rehab is key. This can involve some really clever coping strategies, like just giving the alien hand an object to hold to keep it busy. And one of the most fascinating treatments is something called mirror box therapy, where you use visual feedback to basically trick the brain into reestablishing that sense of ownership and control over the limb. It's a real-life brain hack.
When you get right down to it, alien hand syndrome does more than just fascinate us. It really forces us to face a pretty profound question. It shows that our sense of self, that feeling that we're in the driver's seat of our own bodies, is actually a pretty fragile thing, totally dependent on all our brain's complex wiring working just right. It proves the line between what we intend to do and what our bodies actually do isn't nearly as solid as we like to think. And it kind of leaves you wondering, how much of who you are is simply the result of a perfectly connected biological machine?